Hey everybody, welcome back to Living Dayton. Thanks for joining us today. Did you know that 1 out of every 8 couples experiences issues with infertility? For many of them, the diagnosis can be pretty stressful. Dr. Groll from Springcreek Fertility is here with information on the role stress may play when trying to conceive and kind of what we can do about it. Dr. Groll, it's great to have you here.
Thanks, Katie. And so, yes, that stress, everyone, it's not a big surprise that plays a role in our hormones, and that stressful events will cause changes in the cycle, but we're seeing more and more now as far as fertility treatment outcomes really having some benefit in terms of active stress management.
Okay.
And stress itself isn't bad, it's useful in terms of your body's normal function, but we need stress and recovery. And so having an active role to manage that can really help balance your hormones and give a better chance for pregnancy. And
which is what everybody wants that's trying to conceive,
yes,
of course.
And it's pretty fascinating. They had some studies where they looked at the treatments where they had already genetically tested the embryos, everything was perfect, and one of the things where they saw that it didn't work were the stress hormones.
Okay.
And so that when we look in terms of management for that, though, it's not something we can actually measure a level or a particular hormone, and so there's not like a specific therapy, so it really becomes individually tailored. If one person likes to exercise, someone hates exercise, and I tell them to go do that, that's obviously not going to lower their stress.
But exercise is a really good tip. That's one of your first ones about kind of helping reduce the stress.
That's right. And so we know that from regular active exercise, and even with a busy schedule, we're all running every day, but you need some dedicated exercise time because usually it's start, stop, start, stop. And so that when we have at least 30 to 60 minutes of continuous heart rate elevation, that's going to help now get into the hormonal control and some of the regulation.
Yoga is another one that we can try.
Yes.
A part of exercise.
It's kind of got a twofold from the exercise standpoint. Anybody who's done it knows how difficult it is.
Yeah.
And so it's definitely a good isometric strengthening exercise, but also from the meditative standpoint, and there's a very core mental aspect to it as well.
When we talk about doing things, acupuncture might be something you haven't tried, but this is possibility of a help reducing the stress too.
That's right, and there's a lot of things with fertility and acupuncture and seeing different physical effects of it, but one of the things that has clearly been shown in multiple studies is that it's a great stress reduction.
Okay.
And so that if nothing else from that aspect of things can really help as a different tool that people may want to try. And on the meditative standpoint, there's also something called guided imagery, which is one I'm a real big fan of.
Yeah.
Because it's cheap, it's easy.
Anybody can do it, right?
Has very similar outcomes in terms of the studies, and what these are scripted meditations, and so that help in terms of the mind-body centering, and that they've actually seen in IVF studies and fertility studies that they actually get higher pregnancy rates with this.
Okay, which is a great thing. Our last two, support groups and hobbies, they can kind of go hand in hand because you may be talking about a support group and then maybe perhaps meeting a friend and going and doing a hobby. Both of those things can help.
Yeah, that's great. And that for some people, everyone has a different means for diffusing stress, and it's oftentimes very isolating. So getting in with a group of people to share common experiences, a lot of folks find that to be just the thing they need.
Wonderful. Dr. Groll, you always have fantastic advice. If you are looking to conceive, you can go check him out. SpringCreekFertility.com is the place to go, and we always love having you on the show.
Great. Thank you.